And good evening. Welcome to the Building Systemic Resilience for Future Outbreaks, What Works in Hand Hygiene. Before I kick things off, I'd like to mention a couple of housekeeping points just to keep things running smoothly. I think you'll notice as you came in that you were muted. If you'd like to ask a question of any of our panelists as we go through, you'll have that opportunity, and we ask you to use the chat function within Zoom to do that. The other thing is that, just for your information, we will be recording this session as we go through. So without further ado, I'd like to kick things off. Welcome to our session. And our session, as you may notice from the title, is very much focused on looking at the attention that hand hygiene received during the COVID outbreak and discussing and exploring what it would take to leverage that attention and investment in hand hygiene into future resilience. So how we're going to do that today is we're going to be exploring this question from three different angles. The first angle is from that of supply and market-based approaches to strengthening supply chains and products for hand hygiene. A second angle that we'll be looking at is from that of behavior change and what it takes to make behavior change works. We have a panelist here who's had decades of experiences in this area and will help us to think through some of the approaches that have been working. And finally, we'll hear from a panelist that has been working in the public policy realm for many years and looking at taking hand hygiene from a one-off intervention in emergencies and epidemics into a long-term investment in resilience in a country. COVID presented, as many of you know, a unique opportunity and urgency for hand hygiene to become a public policy issue in and of itself. The window of opportunity to mainstream and scale hand hygiene was unprecedented. We saw governments championing hand hygiene in public policy. In a short time span, we saw many governments transforming the best practice in hand hygiene into public policy tools, such as local government playbooks and multi-sector calls to action. We saw a rise in public-private partnerships and accelerators that are intent on strengthening global supply chains for both hand washing facilities and consumables. We also witnessed behavior change programming on an unprecedented scale. The question we pose to you today is, will all these investments translate into long-term hand hygiene investments? If so, what are we doing right? If not, what do we need to do more of? We've picked these three pillars because we've seen strong efforts, and we believe that a mix of these three pillars of market strengthening, public policy, and behavior change are what it takes to propel hand hygiene from a one-off intervention into a long-term public policy intervention aimed at future resilience. Today, we'd like to stimulate your thinking by reflecting on some of these examples from efforts that have been made globally during the COVID pandemic, and discuss with you a little bit on what it takes to make hand hygiene stick going into the future. But without further ado, I'd like to pass over to our moderator for this session, Mr. Bruce Gordon, who is the coordinator of the Water Sanitation Hygiene Program at the World Health Organization. Over to you, Bruce.
Thanks so much, and really thanks for all your leadership with UNICEF. It's really been, I think, a pleasure for us and everyone dealing with you to really experience taking this forward in such a nice way. So I think we're gonna have a really interesting discussion, and as you said, Anne, we're gonna kind of explore these three kind of pillars, and we're gonna do that with, I think, a wonderful panel, all of whom are experienced, as you mentioned, and committed and passionate experts. And then after we hear from them, we're going to be having an audience question and answer and debate. So for those of you in the audience, feel free to post a question or a comment in the chat at any time, and we'll try to collate and comment on that at a later point as we get through some of the initial discussions. So I think what I'd like to do now, without further ado, is I'd like to invite Alex Mung, and he's the head of water and environmental resilience at the World Economic Forum. And he's going to share his experiences on effective supply of hand hygiene products. So over to you, Alex.
Thanks very much, Bruce, and Bruce, thanks for having me with these other great panels. I'm honored to be part of this and great to join everyone today. In trying to organize my thoughts about this topic and what we've observed here at the World Economic Forum, the role of private sector, especially as it took off from COVID-19, I quickly realized the biggest challenge in all of this was to fit it all in the 5 minutes. And also going first bears the burden of not completely derailing the agenda from the start and not being asked back in the future. So I promise not to do that, but what I'd like to do is just touch on a couple examples, a few things we've observed since the COVID-19 pandemic, just to get us going, and then I'm sure the conversation will continue on. So as the pandemic unfolded, we saw private sector spring to action. Beyond the financial pledges made, there were many examples of companies who wanted to leverage their purchasing power, their own products, their expertise to support governments and communities. We saw companies who manufacture these important hand hygiene products as part of their daily business ramp up manufacturing and offer them in kind. Companies like Procter & Gamble ramped up their production of sanitizer and offered them. Colgate-Palmolive manufactured new soaps with special packaging that contained important hand washing messaging and even used their fleet of vans that were idle at that moment to help with the distribution to the much needed places. And it's not only the companies who have hand hygiene as a business line, those who make soaps and sanitizers on a regular basis, but we saw companies adapt their facilities and their processes to make these hand hygiene products available. Some that you might not even think about in this space. Luxury goods maker LVMH adapted their perfume manufacturing process, and the world's largest brewer, AB InBev, retooled their equipment to produce sanitizers and disinfectants to help combat and tackle the pandemic. Now, that might seem simple, but what this also meant in a deeper level is them drawing on their expertise to establish and manage complex and new supply chains, develop and test products to meet standards, get government clearances to do this, to transport all of this, all very important in strengthening of the supply chains here. And even beyond products, companies with deep expertise on logistics and distribution, whether it's someone we might expect like DHL or Coca-Cola, who can get Coke products to every corner of the globe, who lent their expertise and their network in helping to get these products to the much needed settings. Now, what I acknowledge is this was an active response to a unique pandemic situation, not normally their business. But what I wanted to highlight here, taking this opportunity, is the diverse expertise across the private sector that can contribute to supporting the supply and supply chains of hand hygiene products. And importantly, the partnerships that these led to. One example. So as part of their pledge of 100 million euros worth of products, Unilever partnered with the 2030 Water Resources Group and the Bangladesh Red Crescent Society and work with government leaders to help install hand washing facilities and stations at specific government offices that remain open to provide these essential support and services to contain the virus. Now, these were hubs of activity, people coming in and going all the time as they were trying to tackle the virus. And what that actually made them particularly vulnerable settings. So as part of this partnership, access to products, support for disinfection services, necessary equipment, and awareness and training were all provided to these vulnerable locations across 64 districts in this partnership, so that not only we could keep people safe, but that the messages and what is needed to contain the virus could be then spread even more widely through that sort of network effect. Another example that we saw in South Africa, where companies teamed up to support local hospitals. Chemicals and energy company Sasol ramped up, having understood the importance of sanitizer, ramped up process and production in bulk. Teaming up with mining company Anglo Gold Ashanti, who provided the bulk storage tanks for the product, and then again teaming up with the Imperial Group, who are a logistics company, to make sure the safe transport of these sanitizers from manufacturing through to the hospitals in need. Now, no doubt more is to be done, especially as we look toward the rebuild and strengthening of supply chains for the future scenarios and ensuring the health of the most vulnerable are met. And in this context, the longer term build and strengthening of these supply chains and addressing these needs is also a place where companies can play a role. Absolutely, in supporting the development of vibrant local markets, working with their supply chains, with their clients, with their customers, sharing of information of what's needed, what are the market assessments, where are the places where the biggest need exists, and stimulating, let's face it, the demand for these products through clever and creative awareness campaigns. The marketing and advertising prowess of these companies is quite unique. But more so, perhaps less thought about, is actually how to show where these resources, both financial and energy, are most needed in the rebuild to make sure that we're safe. One of the things that I quite enjoyed reading about was Xylem, one of our partner companies, a water technology company, has co-developed an interesting spatial analytical tool called the Water Equity Lens that helps communities assess their water equity performance. Where might segments of populations be most vulnerable, so to speak, based on access to water, shared benefits that are derived, and how resilient the water system is. Now, what this is doing is helping to identify specific areas to target investment that have the greatest positive impact on enhancing equity and ensuring the most vulnerable needs are met. And this also shows where hand hygiene products and supply chains might need to be developed or strengthened. So these interesting tools that these companies can help provide to help direct these resources. Now, Bruce, I'll end it here. I just wanted to offer that as a quick introduction. I know it has been very quick, but what I wanted to illustrate is not only the fact that companies can play a positive role, but also how companies that we may not normally associate with hand hygiene products and supply chains can actually directly contribute and be part of the solution. And they might have a certain segment of expertise, but what we've seen is through these collaborations, these partnerships, the joining of dots, so to speak, and the spaces to share information is actually what makes a lot of this work. And collectively, this is what is needed to have that impact. So I think I've done it in the 5 minutes allotted, and hopefully that keeps us on track. And I'm sure the conversation will continue, but thanks for that.
Yeah, no, and thank you, Alex, and also on behalf of everyone listening. And I think certainly what we wanted here was to get that brushstroke and to get our thoughts stimulated. And certainly for me, it was a little bit of a fascinating, quick deep dive. And I think people will really have some questions and thoughts, you know, about all the usual things about maintaining and accelerating. So really appreciate that. And we'll certainly come back to you, Alex, and hopefully we can dig in to some of that in just a moment. So that was supply chains. And now I would like to turn to another really valued colleague, Annun from USAID. And she is a technical advisor and a senior technical advisor for social and behavioral change at USAID. And she is going to be talking about behavior change. So you have the product, but obviously the big part of the debate here and a huge challenge, as we'll hear from her, is precisely on behavior change. So over to you, Na.
Great. Thanks for having me. Thanks for inviting me. You know, as Bruce said, I do work in the space of behavior change, but the behavior of hand hygiene and hand washing is how I started my career in behavior change, is thinking about hand washing. So I would say I've worked in the space for a long time, over 20 years. And so today I wanted to offer some insights and also drawn from personal experience, but also sort of studying the science of behavior change. So, you know, I think when we started out in the field of behavior change, we really thought that if people only knew that hand washing was necessary, if they only knew that the health benefits, how much how much the health benefits they would get from hand washing, it would be enough. And I remember that a lot when I first started on hand washing in 2005, a lot of our government colleagues in Vietnam would say, well, we just need to talk about how it's going to prevent diarrhea. And we have found out that actually, just telling people about the health benefits in particular is not enough. And the program that I worked on for almost 10 years in Vietnam was really on promoting hand hygiene, hand washing. And at that time, we thought, okay, you know what, if they only wanted it enough, right? If they really wanted to wash their hands, it would be enough. So our program was really focused on, yes, increasing knowledge of the benefits, but then motivating mothers, our target audience, to wash their hands. And towards sort of the end of the project, we really focused on looking at facilities. So if they had hand washing facilities, that they actually had a hand washing station with water and soap, that it would be enough. And now I think just over the span of the last 15 years, we really had an evolution in thinking about how to change all behaviors in general, but specifically on hand washing. And I think with the COVID-19 pandemic, we've really looked at how norms around hand washing as well as other COVID prevention behaviors can also play a really strong role. So also say is that if you can think about sort of a bullseye, and our evolution has gotten wider and wider, and we are recognizing that we need a variety of different factors to address the demand and adoption of hand washing. But I think, one of the challenges of promoting hand washing is the behavior itself. And so when we think about across, for example, the wash spectrum, the sector, we have a lot of different behaviors, and they're actually all quite different in a way. They all, we need to do all sorts of different things. They happen in different environments. And so the thing about hand washing that makes it really challenging in getting people to adopt, but also sustain hand washing behavior is that one, it's a private behavior, right? So you can't always tell if I've washed my hands with soap, and I'm much more likely to report that I have washed my hands, even though I have truly not. It's hard to see if it's been done properly or not, right? It's private, and when you see it in public, nobody's going to be able to say, well, you didn't wash your hands properly. Whereas if you wear a mask, right, and you kind of have it under your nose, people can tell that it's not done properly, and they can help you course correct or, give you the look, like sort of shame you into putting your mask up. But you can't really do that for hand washing. And, the behavior occurs at very different times. So we have different junctures that we promote. So if you're in a wash program, you might promote the 4 critical times and focus really on after using the latrine or after changing your child's nappy after contact with feces. But in a nutrition program, in an infant and young child feeding program, you might say actually before preparing food, right? Or before feeding your child. And then with COVID, we have 2 new junctures, which you could actually argue is almost like a new behavior, which is after you return from being outside, you should wash your hands. Or if you touch public spaces, you feel like you should wash your hands. So all of those adds a little bit of a layer of complexity to it. And it's hand washing, but it's, when you really kind of unpack it, it's not the same behavior because it happens at different times. And when it happens at different times and different places, then, it's hard to access water and soap at all of those places. And the last thing about the behavior itself that makes it really challenging from a behavior perspective is that it's a high repetition behavior. Right. And a lot of hand washing programs really focus on the 6 steps, the accurately doing your hands, but actually the real individual and public health benefits come from frequency of hand washing. So you have to do it all the time. I mean, you don't have to do it perfectly each time because most people are not physicians, but you have to do it so many different times of the day, right? And so again, back to which programs are we promoting? And so at the end of the day, you end up promoting to practice ideal hand washing behavior. You could be doing it up to 20 times a day, depending on what you do that day. So again, making it that adds to the layer of complexity in addressing this behavior. And so basically, what we've learned now and sort of what we're doing better, I think, in our hand washing programs is we're looking at specifically what is happening during that juncture. So we are understanding the challenges that the person has to overcome, which will differ if it's hand washing before cooking, if it's hand washing in the home versus hand washing in the schools versus hand washing in a refugee camp, for example. That brings an entirely different ecosystem and an entirely different set of challenges. I think we are starting to focus on designing the environment to facilitate the behavior. So really moving away from thinking about the emotions and the knowledge and the ability, and looking at how can we just design the environment so that hand washing just happens without people thinking about it. So we have examples of how nudges have been used in schools that have been very promising. And then finally, thinking about transitioning our thinking of the behavior as a rational behavior to a more automatic behavior, right? So that people do it without thinking about it. And so the science of habit formation has a series of principles that we can draw upon in thinking about how do we design better behavior change interventions. So, you know, there's like illustratively 6 to 8 principles, including, you know, ensuring that we have the right supportive environment, including the supply chains that Alex was talking about, and having access to water, leveraging the context. Maybe we piggyback hand washing on an existing behavior and make it easy. Perhaps we create a system of cues that then reward people for doing it. Like if we think about gamification, all the games that you see online, they are all designed around the principles of habit formation, which is why our children, my children, are always drawn to those games, because it's creating this feedback loop, this positive feedback loop where when they do it, they're instantly rewarded. And so how can we think about hand washing more in that way? But then, you know, all the things that we're talking about for demand creation, it really isn't enough. Right? And having the supply chain, a perfect supply chain, is also not enough. I think the last ingredient of the secret sauce to promoting better and ensuring adoption of hand washing is the enabling environment, the political environment where the government supports, promotes, and invests its funds in hygiene programs. So with that, I'm going to conclude, and I'm going to hand it over to my colleague, Dr. Mohammed Ibrahim, who will talk about the Bangladeshi government's efforts. So back to you, Bruce.
Yeah, no, thank you so much, Nan, and you've done the transition for me. I mean, it's clear that there are so, you know, you let's say, look under the hood, and there's such an incredible complexity to all these issues. And as you said, there's some good reason to be optimistic, and we'll explore that. And what I'd like to do now is, as you said, the enabling environment, the policies support for this is so incredibly important. And we really have the pleasure now to have with us someone with, again, you know, decades of experience, and that is Mohammed Ibrahim. And he is the additional secretary of the Water Supply Wing at the government of Bangladesh in the Ministry of Local Government. And Mr. Ibrahim, please go ahead with your presentation. I think people are really keen to hear you know, this really central role of government and some of the wonderful things that have happened in Bangladesh. Over to you.
Yeah. Thank you, Bruce, for giving me the floor. Since detection of first COVID patient in mid-March 2020, in absence of a definite treatment protocol, Government of Bangladesh emphasized on use of masks and washing of hands frequently for all citizens of the country. 20,000 hand washing systems were installed in rural areas, with soaps made available with ensuring functionality with spare parts and labor. In a lockdown situation, people were taught to use whatever soap they had. That removes oil and fat from their hand, as COVID has a fat coating, in absence of which it dies. In urban areas, functionality of water systems and distribution lines were ensured with uninterrupted water supply. Government reprogrammed $2,030 million to meet the requirements to minimize the adverse effects of COVID-19. Next slide, please. Water, sanitation, and hygiene has been a priority in our development agenda, and we have following strategies to attain this. You can see 4 strategies we have, of which 2 we have developed during the COVID period, the National Menstrual Hygiene Management Strategy and response to COVID-19. Response to COVID-19 outbreak strategy is most important among these and calls for preventive hygiene and behavior, community resilience, increase access to wash services in schools, healthcare facilities, and public places. Additional financing for wash is also a requirement. We have learned through our experience in last 18 or so months that investment is needed in wash, giving emphasis to hygiene. National hygiene campaign must be continued. Hygiene education and awareness is important to manage outbreaks. Wash services in schools, healthcare facilities, and public places need to be improved. Low-cost technologies are needed, and we should reach hard-to-reach areas. Engagement of private sector and NGOs is essential. Compliance to policies at national and local levels. Next slide, please. This slide shows the financial requirement for Bangladesh. I mean, the previous slide, not this slide, okay. Initial estimate is $900 million US. Our spending so far is 300 million. And we are finding, trying to arrange rest of the money to, move forward with the strategy. Next slide, please. Next one. Yeah. We have devised a roadmap to accomplish our mission with short, medium, and long targets to attain hand hygiene for all by 2030. Short term being responding to immediate pandemic, mid-term being rebuilding infrastructure, long term is re-imaging hand hygiene in society. Political commitment, resilient supply chain, and evidence-based behavior change strategies are prerequisites for effective hand hygiene. Thank you all. I will show you some slides. This is a slide, hand washing device, foot operated. We have installed many of this type, around 15,000 all over Bangladesh. Next slide, please. This is a hand washing station in a healthcare facility. Next one. Yeah, this is a hand washing facility in a school, primary school. We have made 5,000 this type of, and this is counseling with the community, especially with women and mothers. Next one, please. And this is last year, October 2020, observing Global Hand Washing Day during the pandemic with university students. And this is Hand Washing Day in previous years. This is an annual festival in Bangladesh. We try to inculcate the sense of hand washing in our students. This is the political commitment. Our minister, for sector minister, inaugurated the day. It's a photo of that. Next one, please. And this is a certificate from Guinness World Records Limited in 2008. Participation of highest number of students in one hand washing event. Thank you very much for your patience.
Thank you so much, Mohammed. Really a great presentation, and thanks for the sort of snapshots afterwards. It really brought us down to earth on some of the technologies and activities that are taking place. So what I'd like to do now, given that I have the moderator's parole here, I would like to invite all the panelists, the presenters, to turn their video on. First of all, so we can see your lovely faces. So Alex, Na, and Mr. Ibrahim. And what I'm going to do, if it's okay with everyone, is I want to ask one question, sort of my own first. And then I see there's a number of rich questions that are coming in through in the chat, and they're really excellent too. And if people haven't had a chance to absorb them, I will repeat them and address them to the panelists. But really, the first question that I wanted to ask people is, you know, I mean, we did touch on challenges. It's true, but really what we were trying to do is kind of talk about success, right? We were trying to think about what has been working. And we know that a lot of people are spending a lot of money, and there's a lot of good work that is being done, especially with COVID-19. And I think there's some anxieties about how that will be sustained over time. We know from our global monitoring that there are billions without access to hand hygiene facilities and soap and water, you know, and maybe without also that behavioral change support and without policies that are supportive. So I'd like to know from the panel, and first I'm going to ask Alex, what do you think is missing here? I mean, what needs to happen? It's a big question, you know, and it's not an easy question, and perhaps there's no right answer. But just when, you know, you've been thinking about this for a while, and, you know, just taking a step back, you know, what are a few gaps that you see that you might see filled? What haven't we done? Are there any solutions that we really need to kind of, I guess, kind of focus on? So over to you.
Thanks, Bruce. I'll start with one first. I've got a couple ideas, but I'll start with one first. That's, I love being part of these types of forums, and especially every year, you know, I'm looking forward to World Water Week. One of the things that I also get a lot of sort of intellectual stimulation from in thinking about this is what we can learn from other sectors in this regard. As we were looking forward to try and address some of these supply chain issues, we had a conversation with Coca-Cola as one of the companies, and their experience not only in getting their own products out there, but equally their experience working with Project Last Mile, one of the USAID projects as well, getting critical medical supplies to healthcare facilities that were most vulnerable and didn't have them. And so learning what their experience was there using the medical lens, what we could learn from that. Equally, as we think about this, the auto manufacturing supply chain is arguably one of the more complex ones. After the tsunami in 2011, they're experienced quite a lot of disruptions in that. And, you know, car companies like Toyota in particular, you know, had to deal with a lot of this and how they got through. Now, what they did, without getting into so much of the detail, they figured out they even if they wanted to support and help and address some of their suppliers and their supply chain, they couldn't. They didn't actually know who they were, how to contact them, or what they were doing. And so by developing this sort of integrated information database, since then, they're now able to try and pinpoint when there are disruptions in the supply chain from 2 weeks down to 12 hours. So, you know, what can we learn from other sectors and how they've dealt with supply chain disruptions and strengthening the reliability of supply chains is perhaps an interesting way in which we could collectively learn from and help support. So that's one idea, and I'll save the other ones for the continue.
Oh, it's great, and I'm always interested in how these ideas transfer from kind of one sector, you know, or industry to another. It's always amazing that some of it's been worked out by others. So now I want to go to you with the same question.
Yeah, so I think Alex represented the sort of recommendations for the private sector, and you know, and I can think of some recommendations for the public sector. I think one of them is like obviously learning from the private sector, but then what can we learn through COVID about getting vaccines to the supply chain of vaccines to the healthcare facilities? What can we learn about, you know, a lot of our sort of knee-jerk reactions to these pandemics as far as like behavior change. So we had Ebola. So what did we learn about Ebola? We've had tons of learnings on behavior change and how to successfully message and be credible during COVID, which we can argue that many governments have not, including the United States. We're very poor about our messaging, sometimes continually are poor about our messaging about what people should do and what they should not do in the pandemic. And so, thinking about how the government can be more forward-looking. I think in our lifetime, there will be another pandemic. There will be another, there'll be many emerging diseases. So how can we, after this, think about how can the public sector, the donors and the governments and all the agencies think about how do we better position ourselves to guide people in the next outbreak. And so I feel like, as we do these hand washing programs, we can call those lessons and be better prepared for sort of the next pandemic. But I have to say that we also have to realize that there are a lot of behaviors that we promote. We promoted a lot of behaviors during COVID, and in and of itself has been an evolution of the different behaviors that we've emphasized. So the first behavior was hand washing with soap, but then it was social distancing, and then it was masking, and now it's vaccines. So I think we also have to realize that we are competing with lots of other behaviors, and that, as much as we try, we ultimately also have to think about there is behavioral fatigue, and that people will not always be able to sustain hand washing, and that hand washing is a contributing behavior. But right now, the really sort of most foolproof way to not get COVID is vaccinations. And so thinking about the focus, right, between keeping the focus on hand hygiene versus other behaviors that will reach the public health objective of the time, I think also needs to be considered. And not to say that hand hygiene isn't important, but is it the behavior that we need to promote all the time, given the various public health challenges that we're facing?
I'm so glad you said that. I think that we need to debate that. I mean, can we keep this up with this frequency all the time? I won't throw my 2 cents worth in, but I think you also made a nice segue, as usual, to Mr. Ibrahim about this sort of government public health outbreak or readiness. So over to you, Mr. Ibrahim, for the same question.
Yeah, thank you. Somewhere I was reading an article of one professor of psychology. Her name is Barbara Mullen. She is from Carleton University. That even in America, in the United States, people didn't wash their hands because they thought COVID is a disease of the old people, and physical fitness is enough to face COVID. Similarly, same thing I have seen in our country also. I mean, people in rural areas thought that it's a disease of the cities, and they will not be affected with COVID-19. But the second wave of COVID in Bangladesh has shown that it is a disease of everyone. So, I mean, from these examples, 2 examples in America, where I mean, it is you have a lot of hand washing facilities and lot of soaps and other things with which we can wash your hands. People didn't, go for that habit, practice of hand washing. And in our country, where hand washing facilities are less compared with America, people also thought in the same way. So to me, it's most important is educating people. I mean, if you can start educating people at schools, and if you can educate their mothers about the benefits of hand hygiene and other benefits, other habits, I mean, in 10, 20 years, this will become a national habit of any country. So I think that practicing good habits is most important, and we should include that in our education. It should be a part of our education. Thank you.
Thanks so much. Oh, I see. Now you're.
Yeah, I just
Please
had a
go,
comment.
come in. Yeah.
I wanted to say that, you know, one of the principles of habit formation is to getting people to practice it. And I think that the role of the government in providing just what they did in Bangladesh with public facilities so that people can practice the behavior outside of their own home, that they can see other people practicing it, I think is a crucial thing. I think yes, education, I think after COVID, I think we can confidently say that most people around the world understand the need for it, but we as governments, donors, need to also provide them with facilities where they can see and practice it, so that it becomes a habit. It just can't be through awareness raising campaigns anymore. I think that's so clear that we have to think about modifying the environment to enable practice of the behavior so that it can be habitual and that it becomes a norm. I'm seeing people making comments about social norms and whatnot in the chat box, but just think about the behavior. If it's a private behavior, we have to make it a public behavior, and therefore we need to think about hand washing in the public space and how do we provide that enabling physical environment for people to do that. Over.
Fantastic. That was a great exchange. Now, listen, we have, like you said, there's just a tremendous amount of really interesting comments in the chat, and we're going to get to those in a moment. But I would like to invite the lonely hand. I saw a lonely hand come up. So we're going to try to find that person that wanted to ask a question. Could you re-raise your hand? And I will go through and try to find you. Because I know there was a hand there, so there's someone dying to ask a question. So please put your hand up, or I will take the first question, the first hand that I see, and then we will try to do it in a little bit more fair way and do it in the order of the chat and kind of consolidating that. But I can't see anyone with the courage to engage in this lonely world of Zoom. So unless I see someone commenting, I'm going to move to the questions that were asked by the panel, or sorry, by the audience. So I think just scrolling up, you know, there was a couple questions. I don't know, Alex, if you spotted them. There was a number of really excellent questions, I think, by a number of people, but by Beverly. And I just wanted to. She was asking, you know, sort of us technocrats, and many on the call are the technocrats, the WASH folks. How do we maintain interest of the private sector to continue investing in the hand hygiene and associated value chains? So I think she's sort of asking, what can we do to engage the folks that you engage with? So yeah, I'll leave it at that. Go ahead, Alex.
Sure, thanks, Bruce, and thank you for those questions. Actually, I might take, there were two actually that
okay.
And I can probably wrap them up in a little bit. So I think there's an interesting question. How do you continue to engage the private sector in investing in hand hygiene and supply chains and such? I think one of the key things is actually to acknowledge actually that while private sector companies do have a lot of expertise, and many of the teams within these companies are very knowledgeable in water, hand hygiene, the importance of, etc. They're not necessarily experts. Many, like the folks around the tiles here. So while they might understand that, yes, it's important, having that conversation with them, engaging with them, not necessarily throwing facts at them, but engaging them in conversation to try and identify what are the specific issues. What is it that we're trying to overcome? Not just, you should invest, it's important. That won't help them. But you know, we're having troubles trying to find adequate manufacturing facilities in country X. Do you have anyone in your supply chain? So trying to get as specific as possible and engage with them. These people are naturally interested. They're good-hearted people, and they will want to help, but they need help in identifying these specific pain points or problem sets. So I think that's one, and helping, so engage them, and that'll continue with their interest. In terms of that innovation question, while yes, there are some specific companies that I do know that are, let's say, trialing, let's try and minimize packaging or shrinking the actual size of these sanitators to make it easier to distribute, transport, but also the price points would come down. Or instead of a giant bar of soap, are there sort of slivers of soap that one can actually take? So these innovations are happening. But again, what's perhaps interesting in this space is having that space to engage in that conversation. It's not a formal sort of, this is important, please do it. But it's finding those specific pain points and engaging with them to try and co-create these types of solutions, or what would be useful. And that will spark additional ideas. So I think to help answer those two questions, hopefully.
Okay, brilliant. And that's given us time to kind of try to select some of the good questions. And I think there's one now for Yuna, which is, would the insights on how to effectively influence hand washing behavior differ according to the particular settings? And the examples were given for healthcare facilities versus households.
Yeah, I think it's an excellent point, and it's it's a further way to reiterate my previous comment, which is we really need to understand the physical context in which the behavior is happening. So when you're washing at home, you have different competing priorities, but when you're trying to practice hand hygiene at the healthcare facility, you have different priorities. You have many patients, you have to go to different rooms. You go to different wings in the hospital. And so your context is always changing. Whereas in a home, you have a stable physical context. So you know where your facilities are, you can plan for it. But in medical facilities, I think it's interesting because we have two sort of potential solutions for hand hygiene in facilities. You have the alcohol-based sanitizers, right? You can install those even in the absence of having plumbing in each of the different rooms. You have alcohol-based sanitizers, but I can tell you that my father was ill last year, and I went to hospitals, and there was not alcohol-based sanitizer stationed in every single room. So if you think about all these nurses and healthcare providers moving in and out of rooms, and they do not have physical access to alcohol-based sanitizer, and there's no sink in the room, how can we expect them to maintain hand hygiene when the very basics are missing? So I think understanding sort of that journey, like what is happening in the facility, will help us to figure out what the pain points are and to figure out how to overcome those challenges. And yes, so also say it is very different in a healthcare facility versus in a household or like in a refugee camp.
Okay, fantastic. Now for Dr. Ibrahim, what was the tipping point that convinced the government to actually invest in hand washing? What was done differently relative to previous advocacy efforts to unlock more government financing?
Thank you. I think the tipping point was when expatriate Bangladeshis started returning from Italy to Bangladesh in late March last year. I mean, at that time, the COVID was spreading very fast in our cities and villages because they carried the virus from foreign lands. And the government thought that, without a definite treatment protocol and required, because at that time it was thought that ICU is required for treatment of COVID. So, and in this situation, government decided to, invest in hand hygiene, in buying masks and social distancing. These campaigns got momentum in this type of situation in mid-March last year. Thank you.
Okay, thank you so much. Now, I see a number of great comments, if you feel comfortable, I'm going to take one from Julie and one from Helen. So Julie, I don't know if you feel so inclined to turn your video on and ask and make your comment, but if you do, go ahead. You're still muted. Oh, maybe you can't. Maybe we've not allowed you to do it. I'm so sorry. I was having too much fun there. but you can leave your video on and I'll ask your question for you. I just thought people might be sick of hearing from me. So
Actually,
Julie was,
I
oh,
think-
she's on.
Sorry, I think they allowed me to speak. So yes,
They hate me now in the background. I apologize to all the
No, no.
technicals.
No, hi everybody. Yeah, I guess my question was just in past hand hygiene for all discussions. Someone noted, it might have been you, Bruce, actually, about how hygiene is everywhere yet nowhere in terms of institutional arrangements. And that was just really my question that resonated in terms of the different aspects of hygiene, whether it's infrastructure, supply chains, behaviors, they're across different ministries and government and mechanisms and preparedness plans and things like that. So how do we bring that together, and who would really own that across different sectors? So that's really my question, is just how do we structure that to really make this difference in the enabling environment that's required, that's been commented on as well today. So thanks.
Great. Okay, that's fantastic. And I'll give the panel a moment to just sort of absorb that about who owns or can take responsibility for hygiene so it doesn't fall between the cracks. And with apologies to the tech crew, I'm going to ask Helen to come in too, if they can unmute her. I don't know where you are, Helen, if you could turn your, yeah, go ahead, please.
Yes, thank you very much for the good discussion. My question is, I think there's a lot happening in the world, and the message is a bit conflicting at the moment, because with COVID, we are told it's airborne, others are saying no. So initially when it just started, there was an issue of saying wash hands. Now, when they said it's airborne, people abandoned the washing hands. So what type of incentives can be put in place to make sure that people are really washing hands? Because where I am now, people are not. Thank you.
Okay, fantastic. Thanks, Helen, and thanks, Julie, for just kind of making this a little bit more, kind of friendly and face-to-face. Now, so we have two questions, and maybe I'll go in backwards order and ask Mr. Ibrahim if I don't know if you want to deal with if you have something to say about the incentives, what incentives we can put in place, or maybe the question about how to take responsibility for hygiene, because it seems not necessarily to have a home sometimes. So over to you, Mr. Ibrahim.
I mean, if I consider the social context of Bangladesh, I mean, our culture, I'm explaining in our context. In our culture, we do not use spoons, I mean, for eating and other purposes. So we use hands. So washing hands is you can say, our habit from childhood, because we have seen our parents wash their hands before I mean eating, and in our toilets we use water instead of tissue papers. So if you ask me, in my context, I would say that we don't need any incentives for this, because it's a part of our culture in Bangladesh. Washing hands before eating and in other purposes. Moreover, the weather of our country is like that. We wash our faces and hands, I mean, to have some comfort. So it is very natural for us to wash our hands and faces. I mean, the economic condition of Bangladesh is getting better, and we are having better toilets and better hand washing facilities in everywhere, like shopping malls, in schools, in offices, and people are getting I mean, conscious about their faces, their cleanliness, freshness, all those things. I mean, in our context, if you ask about incentives, I would say we don't need any incentives for hand washing or other things. It is our habit from the childhood.
Okay.
Thank you.
Thanks, Mr. Ibrahim. So I'm seeing the time, and Alex, no, you get a chance, but can you keep it to 30 seconds each, please? Sorry to cut you off.
Yeah, well, I want to challenge Mr. Ibrahim, because I think you do have incentives, and you have just articulated all the personal incentives that would motivate somebody to wash. It's a very practical incentive to me. It's not public health, it's feel fresh, feel clean, keep your face clean, look tidy, feel confident, right? Be clean before you eat so you handle your food with clean hands. I think thinking about incentives to me has really been, I think for hand washing is very much about personal incentives. How do you feel immediately after hand washing? Those benefits that come immediately to you, the practical benefits, I think are the ones that are going to spur you to continually wash your hands for those immediate benefits. Thanks.
Great. Good to see some debate. And I'm actually sure you were kind of saying the same thing in different ways. So Alex.
Well, Bruce, I was just going to say, I'm happy. I think Ibrahim and our colleagues on the panel actually said it greatly. No need to add anything else from my side.
Well, thank you so much, Alex and Nan and Mr. Ibrahim. Like, this has really been a pleasure. I had a great time talking with you. I'm sure all of you on the panel would have liked to exchange more with the audience. And of course, we have our constraints, but I would like to thank the audience for the questions and the comments and the brief interventions that were made at the end. So with this, I would conclude this. Thank you all. And I would like now to turn over to Nat Painter, and he is really kind of behind the scenes, the one that made this session work with his colleagues at UNICEF, and he's the UNICEF's Global Hand Hygiene for All coordinator. And Nat, I'd love to hear your closing thoughts and what you think, where we should go from here. So over to you.
Great. Thank you, Bruce. Thank you to all the panelists and the questions that came in today. I feel like this has really been such a rich discussion, and of course, there is really never enough time to fully cover the topic. Just a few things that struck me while I was listening to the conversation. I think one is, you know, where Anne started the conversation of saying there's been this unique opportunity that has arisen from COVID-19. And usually when we describe that, we articulate it as the attention that has come to hand hygiene, increased resources that have come to hand hygiene. But what has really struck me in the conversation is really it's a much broader opportunity that has come together through this crisis. Alex talked about some of the innovations that have been arising through technology, through distribution, through other approaches from the private sector. We also heard from Nya around some of the behaviors and design innovations that have arisen from the COVID-19 crisis, and really forcing the sector to adapt quickly, to see what works and to deploy it quickly. And then similarly for Mr. Ibrahim, the incentives and momentum that was put behind the government of Bangladesh in pushing forward on their hand hygiene agenda. You've introduced the new term that I was hoping to never hear of behavior fatigue. I already have Zoom fatigue, I've got Teams fatigue, and now I can add behavior fatigue to it on top of my just general fatigue. So I'm hoping we can solve that issue and come forward with some sort of focused approaches that will minimize the behavior fatigue and all the demands that we're asking on people around the world for how to adapt their approaches and their practices so that they can better manage their health and drive it through exactly the discussion that was happening at the end, through how do they feel through better hand washing? What are their reactions after washing their faces? I think that's really an excellent point around the drivers. Another point that I might say is around the sustainability. And typically what I've seen in discussions of sustainability is really around sustaining programs, sustaining financing. But what's been interesting here is to broaden it. So yes, programs, yes, funding, yes, attention to the topic of hand hygiene, and of course, ultimately sustaining the behaviors. So where I want to wrap it around is back to the title of the session, what works in hand hygiene? And I think we don't have that answer. And the benefit of being the closer is you don't have to have the solution, but I'm really challenging the hand hygiene community to address this question. Later in the fall, we'll be releasing the State of Hand Hygiene report, which will help update where we stand on hand hygiene as a development sector. But I would really like to issue a challenge to what is going to be the first country to achieve universal hand hygiene. who will be able to declare that they're the most hygienic country in the world? And I think, unfortunately, the bar is so low that it should be something that a country could take on to plant their flag as being the ones that are leading the sector in this. So please keep an eye out for the State of Hygiene report, which will be released on Global Hand Washing Day. But in the end, we'd like to thank Anne for opening up the session, Alex, Nia, and Mr. Ibrahim for your case studies and the debate, Bruce for moderating the session, and those who didn't see here, but Joe Estevez-Mills, who really helped keep the session moving forward. So thank you all for attending, and have a great evening, morning, afternoon, whatever time of day it is for you, wherever you are. So thank you all, and keep washing your hands. Bye now.